My journey with infertility started in 2019, a little over a year and a half ago. And it was absolutely devastating when I found out that the only way that my husband and I could have children, or the only way that I could give birth, was through in vitro fertilization. And that was because, one, I had low ovarian reserve and he had male factor. I didn't know what to do. I had never known, seen, heard of a Black woman having to go through IVF. The thought of infertility for me blew my mind because every woman in my family that was able to have children. You know, my grandmother had 5 children. My mother had 3 children. My aunt had 3 children. This was both on my mom and dad's side. So the idea of infertility never crossed my mind. And when it did, it was heartbreaking. But, you know, IVF was an option for us. And even though I kind of had an idea about what that was, I wasn't exactly sure. So I had to do my research. I did my research, and it definitely is a process. We have gone through 2 rounds of IVF. After our second round, we had 3 embryos. We did have a successful transfer, which unfortunately ended in a pregnancy loss, but we do have 2 embryos left. But what I think is the most important thing, especially as a Black woman, is to be informed. I started my journey into wanting to be a mother a little later, but don't let anyone tell you to wait because you're young, because you never know. You should always know your body. You should always know the situation that you're in, regardless of how old you are. And you need to make sure that you have the right providers in your corner. I have awesome doctors who said, here's what the situation is. Here are your options. Here is what we are going to do to help you achieve motherhood. And while the journey has been stressful, it's also been rewarding. I have people in my corner who care about my healthcare, who care about my well-being, who makes sure that I have all of the resources that I need and that I am well informed to be able to make the best decisions about my fertility. So whoever is going through this journey, I encourage you, one, to find the right care provider who knows you, who knows your body, who knows what the situation is for you as a Black woman. I also encourage you to do your research. There are resources out there. There are resources out there specifically for Black women that are going through this journey of infertility, that are there to help you and educate you and help you along this difficult, challenging road.